No.
Huh? Uh-oh.
Nug will always be on the damn test.
I have seen, salivary glands. I'm sorry, y'all. My braces are tight today. I just got them tightened. 1,500 milliliters of saliva daily. I have seen that. Write that down.
So not to be weird, but there's an easy way to remember this is 1,500 milliliters is also the urine output daily. So the same exact number for saliva and urine output.
How do you know that?
I just have a memory that remembers a lot of things.
He works as a medical doctor at night.
Cover my day. I appreciate you.
No problem. Yeah.
Everybody got that? Yep. 1,500 milliliters of saliva daily. This transition is jacking me up. The most common lesion, abscess, cyst, and ulcer. Just know that. Just know, really, they ask about abscess.
Honestly, as medical corpsman, this is probably the part of dental that should make the most sense to you because it's literally the same kind of stuff that you guys see for abscess, cysts, and ulcers.
They're going to ask about specific ones, though, so I'll give you all a second for those of you who want to write it down. That's me.
I remember when I print off that. You needed me to find something. Oh, the
course
critiques and the fact reader.
Yes, please. Thank you.
I don't know why I don't know what's going on with my eyes, but I feel like I can't, like.
Do you need to get closer?
No, I'm as close as I can be, but I feel like staring at this screen, like my vision's just like going blurry, and then I get this ringing in my ear that's like really killing me.
Oh, you're going through it, girl.
Be right back.
Yeah, I think I might.
Yeah, no problem.
All right, I'll see you guys later.
See you later. Drive safely.
No, I'm coming back. I gotta go print off some course material.
I'm into the next one, okay?
Thank you. Print off the Corbin manual while you're at it.
I gotta charge you guys for that. Use the printer in the office.
I got $5 when I get my Hurricane Katrina relief check.
I'm done.
I'm sorry. Can you go back? I'm almost done with that definition.
Ooh, abscess. I know it's messing me up. It keeps going black. Abscess, cyst, and ulcer.
It says commonly talk about the child's infection.
And then the questions they'll ask are more specific. And we'll go into that. Next, from this slide, we all know what a hematoma is, correct? Bruise. From this slide, I have seen it on so many exams. Petechiae. You'll probably see it. They are round, pinpoint, non-raised, purple, red spots caused by mucosal or dermal hemorrhage. They ask that on so many exams.
So,
Petechiae.
remember how I said things can throw you off? Do not study the word purplish red because look at the next line.
So, as we know, hematomas are purple, red. They're all kinds of colors. Petechiae are very small bruises.
Keyword there is pinpoint.
Yes.
Pinpoint.
Blood under the skin.
Yep.
Usually I see these like on the roofs of the mouth. So somebody like had a sucker the day before or something like that. They're really going ham on it. They're they usually that's what I'm like. Did you eat a sucker? Were you eating a sucker recently? And they'll be like, yeah. And I'm like, okay. But petechiae are round, pinpoint, not. I see
Y'all
that
are
on
messy.
so many exams. Ecchymosis, large purple red areas caused by blood under the skin. I don't think I've seen ecchymosis on there. But both of these are flat, they're non-raised. Vesicles are small elevations that contains fluid. Most of these are in the oral cavity, which they erupt and leave superficial ulcers.
Have you ever seen them ask that? Like, what are the two most common elevated lesions, or?
I haven't from this slide, but I've seen them ask
Not worded
TKI.
like that, but I remember a petechia question last year.
Yeah, I have seen that. I've seen that on a few of the.
Question.
What's up?
Because the last slide were also lesions. Are those like categories for these?
Yes.
All under. So which one?
The other ones were categories.
So for the elevated and the non-elevated, which one falls under?
Abscess cyst.
The elevated, would that be like the abscess and the cyst?
I wouldn't call it any of them, to be honest with you.
So what is it? So they both say most common lesions. So which ones are
this
they?
Oh, this is below the surface. I'm sorry.
Okay.
Below the surface, yeah.
Okay.
Are the three different categories?
That makes sense though, because the abscess is normally like at starting like in the gum line or like.
It's
below.
underneath, yeah. It's underneath, so you can't see, like, you won't see it, like, I mean, you can see if it's swelling around it, but you won't see the actual abscess. Or the actual cyst or anything.
People come in and they'll just be complaining that like their teeth hurt,
Mm-hmm.
but it's not until maybe like a day or so later that y'all can actually see like, okay, they have an abscess.
Or they waited too long to come in for their tooth hurting.
Oh yeah, and then their face is like swollen.
I've had this pain for 4 months. Oh, you're just coming in now?
1.5 liters.
1,500.
1,500 milliliters, you might be right, I'm not a conversion.
It is, it's 1,500 milliliters.
Yep. And the average temperature of the mouth, we all know this because we're Corman, right? 98.6. This is another naturally,
Oh, baby, I can't see it small.
that's okay. We're gonna skip it. Dental caries. Dental caries are cavities. Anytime you see the word dental caries, we're talking about cavities. It's decay in the tooth.
Decalcification. So I wanted to hit on that point too. So when you hear calci, it's usually related to calcium because that's calcium deposits are what make up a tooth, right? So decalcification is the breakdown of that structure that causes cavities.
Can I spell its name? Decalcification?
Mm-hmm.
Everybody good with this slide? The decay process, I haven't seen them ask anything about this. It appears as white chalky spots whenever we're looking in the mouth, but I haven't.
That one's been a test.
starred. It has?
The white chalky spots has been a test question.
Okay, so white chalky spots, if you see that on there, it could be caries.
So this is, the starting process of the dental caries?
No,
Correct.
this is
This is?
the caries.
Spot is a dental caries.
A white chalky spot is a dental carie. The first step in dental caries is decalcification. So it's the breaking down of the calcium in the tooth.
Is this like when people on drugs and you can see their teeth kind of going?
That's further down the line. That's caries though. That's caries.
I feel like it starts like this. You can see it. They'll be like, you know, you see.
You can see you'll see that it'll be a different color on your tooth. If somebody's ever had a cavity or a carie before, you'll see the discoloration there to
Oh,
know.
when it's brown looking like wooden teeth?
That's really. Yeah.
You mean like meth house, right?
Well, before that, before they even before you know they on meth. Like when you starting to guess that they on meth, but you don't know yet.
Okay. It's probably just decay. It's caries.
Oh.
Yeah. And then it gets to be on all the teeth. And then you like, that's meth mouth, right?
Yes.
They're close to necrosis on those teeth.
All right. Next. I haven't seen them ask anything about the types of caries. Just know caries are cavities. We're gonna skip this. Oh, dental caries first appears as what on the teeth? The white chalky spots. Okay, so I've seen this one. Might see this one. I've seen it on multiple exams. Pulp algia. Pain in the dental pulp. Normally after a restoration. So after you've already you came into dental, they put a filling or something. They did something to your tooth. But now it's sensitive to temperature, to touch, in sweet or sour foods. Here's what you need to write down. Pain is described as short and sharp, increases with lying down and walking upstairs. That's this little bullet is what you need to know. Pulpalgia.
Yep.
Pain is described as short, sharp pain, increased with lying down or walking upstairs.
For these words, knowing the how to break down the prefixes and suffixes of the word itself is what's going to help you, because Asia is already related to what? Pain. Right? It literally tells you in the word that it's pain of the pulp.
Short, sharp, increases with lying down or walking upstairs. Pulpalgia. If it's not on this next exam, it's going to be on another one. I've seen it since I've been in. It's always, they ask, like I said, they ask the same few ones.
I've been seeing it since 2013.
There we go.
So first time I took the first class.
Pulpitis, inflammation of the pulp. Pain is a dull ache that can lead to more severe pulsating pain, but pulpitis, inflammation of the pulp. Dull ache.
So to memorize, you just pay attention to what kind of pain it is, because that's usually what the indicator is for each of these. Dull ache is always going to be related with pulpitis.
All right. They will ask periapical abscess. So, periapical abscess. Again, for those who know medical terminology, peri is around, apical is apex, abscess. An abscess around the apex. Okay?
I want to give you guys a visual for this to make it make sense. Right? Because it's going to explain all that in the symptoms. Okay? So, if you have an abscess near the apex, right? Where's the apex again? Very tip of the tooth, right? So if you have a abscess in that space where there's no space to be, it's going to try to make room, meaning it's slowly going to push that tooth down, right? I say that because if you look here, patient complains that the tooth feels high when biting and is very sensitive, because the abscess is literally pushing the tooth out of its socket. That makes sense? Okay, and then that one that's been on the test, when you do an actual x-ray, it'll look like a grape. That's been a test question. It'll look like a grape when viewed on an x-ray with the actual abscess. And like any other abscess that you see here, what do you think the usual treatment for an abscess is?
Antibiotics and pain medication?
Yes. Does that help make sense to y'all?
No, it didn't, but it's okay.
So, remember, like I was saying before, peri, around, apical, apex, which is the root of the tooth. It's an abscess around the apex of the tooth. Remember, patient complains tooth feels high when biting down because they've got that, like you said, that grape on the root of the tooth. So whenever they bite down, it feels high and there's pain. I'll just bring this up. Whenever it's draining, the course of the pus from abscess goes from the apex and into the jawbone, drains into the mouth. It's called a fistula. So it's a tract that if it's not sitting right up under if it's not in a cyst and it's right up under there, it'll form a tract and go into your jawbone and you can taste it in your mouth.
That's disgusting.
That's a fistula. The tract is called fistula. Yeah, they can taste the pus and the infection. You can usually smell it as well.
What is it?
It's terrible. It smells like death. All right. I'm going to hit this next slide, okay?
Yes.
Necrosis. Necrotic teeth must be... We all know what necrosis means? Yes. So they must be treated. Death of tissue. So dental pulp tissue produces toxins that smell foul and rotten when the tooth is being treated. Next slide. Periodontal disease this is a test question as well. Periodontal disease is the most prevalent chronic disease of humankind. The wording of that is very important.
Not cancer, not diabetes, periodontal disease.
Most prevalent chronic disease of humankind. Periodontal disease affects the periodontium, which is the tissue supporting the tooth, around the tooth. And it affects the surrounding teeth and tissues. The symptoms of perio disease: bleeding during brushing, tender, red, swollen gums, receding of gingival tissue, tooth shifting or elongation, so the teeth are moving or they look longer, mobility, purulent discharge, so pus, abnormal fit in dentures, and halitosis. So don't confuse periodontal disease with gingivitis. Periodontal disease is you're losing bone, which is why a lot of these symptoms are different than gingivitis. So they start off as gingivitis, but then it's tooth shifting and elongations because you're losing bone. Mobility, that doesn't happen with gingivitis. Mobility is because you're losing bone. Same with all the rest of them, except bleeding during brushing, tender, red, swollen gums. But there's no receding of gingival tissue in gingivitis. This is all perio. Say again?
Nothing. I was just alliterating.
All right, I'll make this next slide. Gingivitis is inflammation of the gingival tissue. Marginal gingivitis is the most common. It's caused by poor hygiene and affects both gingival margins and the papilla. Papilla is the gum tissue in between your teeth that forms that V. That's papilla. So main characteristics are swelling, loss of stippling on attached gingiva, redness, easily retractable sulcus, tendency to bleed easy.
Okay.
What's up? What you got? So write down marginal gingivitis is the most common.
Most common
Yep,
form of gingivitis, right?
that's correct.
I don't know, I might need some glasses.
So the screen is kind of
Yeah,
flipping
it's
a
blurry.
little bit.
It's
I noticed
That
that it's like
projector
a,
is
it's like a
not
fast.
Okay, so it's not me.
No,
You see, I keep having to do this just so I can see.
Does it help?
No,
It
you don't.
does. Like, I'm not even lying to you.
Huh.
Do what you got to, sis. You need this.
So the next thing that, if you don't see it on this next exam, it's gonna be on one. NUG, necrotizing ulcerative gingivitis. So you'll see it as NUG, necrotizing ulcerative. Thank you. Ulcerative gingivitis. You can see it referred to as trench mouth, also as Vincent's infection. So know all three names for NUG. Symptoms include redness, swelling, pain, calculus, bleeding, scab-like film. So this is, do a star, highlight, underline, do what you do. A film of bluish gray around the teeth. You can normally see it on the gums, a bluish gray film. So it's death of the gingivitis. You usually see this whenever, I'm FMF, so like I would see it whenever Marines would come out of the field. They wouldn't take a toothbrush, or they just wouldn't use a toothbrush if they were out in the field for a month, 2 months after deployments. So if that helps you remember trench mouth, when people were in the trenches, during war, they weren't brushing teeth, so they're coming back. Trench mouth. I don't have a good way to remember Vincent's infection, just Vincent's infection.
Vincent had trench mouth.
Vincent, man, he had trench mouth. He had that blue-gray film all on his teeth. I know. I hope nobody in here is named Vincent. All right, I'm gonna hit this next slide.
Just a quick point of clarification.
What you got?
So we've seen the word calculus pop up at least twice so far. Could we get a quick definition on that?
Sure. So most people so calculus, it's not math. It's not only math. It's, most people in lay terms say tartar. It's plaque that's been sitting on your teeth. Everybody's different. So it could be 24 to 72 hours and it's gotten hard. You can't remove it anymore with toothbrush or floss. Calculus is hardened plaque or tartar.
So it could also be referred to as built up tartar?
It could be build up. You can have plaque build up. You can have calculus build up.
Okay.
But calculus, yeah. So it's bacteria, because inside plaque there's bacteria, but it's a more mature bacteria than plaque because it's had time to grow and to mature.
So is it like a biofilm?
No, so plaque is biofilm.
Okay.
Plaque and biofilm, they're used interchangeably. They're the same thing.
Same thing, but different.
Once it's been there for a while, it gets hard. Now that it's hard, calculus. It's harder.
And that just comes from people not brushing their teeth?
It does.
Brushing, flossing, all the things. Missing spots when they are brushing their flossing.
By the way, we know when you don't floss. You can't lie to us.
Yeah.
Periodontitis, we talked about periodontitis a little bit. Chronic inflammation condition that involves the gingiva, crest of the alveolar bone, and periodontal membrane. Loss of supporting bone, periodontal pocketing, and increase of mobility. So like I said, periodontitis is when you start to lose bone. Gingivitis, you still have all your bone. It's inflammation of the gums. Once you don't treat gingivitis, the bacteria is sitting there, it's maturing. Now we're getting into you're losing bone, periodontitis. It's that's why it's chronic, because it's not just something that happens really quick. It's been developing. Loss of supporting bone, periodontal pocketing, and increased mobility. I've seen this on the exam. Bluish red gingiva and recession will progress as the disease progresses.
That's periodontitis.
Periodontitis, that's correct. I'm sorry.
Oh, you good?
That has a smell of its own as well. Not being able to chew or brush teeth, unpleasant odor, foul taste in the mouth, bleeding. That's referring to nug. The first, just so y'all know, that first bullet, that's still referring to nug. They also I've always seen it, I've seen it on multiple exams, pericornitis. Inflammation of the gingiva around a partially erupted tooth. So, caused by inability to keep the area properly clean, can cause a gingival flap. So, with this, you usually see these on wisdom teeth that are coming in not straight up, they're coming in at an angle. So, half of the tooth is out and then half of it is still covered by gum tissue. I've seen that asked as well, which teeth is it most common to see pericornitis? The third molars, or the wisdom teeth. But that's when you normally see it. My weird way of remembering it is peri is around, cornitis, I think popcorn. Get a popcorn husk stuck under the gum tissue, not able to get it out, inflammation. That's my way.
That's the term that I'll use on the test, is popcorn husk. So you got to relate that with pericornitis.
Inflammation of the gingiva around a partially erupted tooth. All right, recurrent active stomatitis, also known as canker sores. Healing time is usually 7 to 10 days. Recurrent active stomatitis. Found on the cheek, so buccal mucosa, the cheek, tongue, soft palate, and floor of the mouth. It can be caused by physical, emotional stress, harsh foods, and or toothbrushing. 7 to 10 days to heal.
That's your rite of passage. Oops.
All right, another one of these. Whenever I haven't seen them ask too much about HIV/AIDS, I really haven't even seen them ask about herpes simplex, but they are viral infections that we can see. Obviously, if you have or if somebody has a herpes ulcer in their mouth, we can see it.
The only thing I ever asked is just knowing what HSV1 is compared, because what's HSV2?
That's genital.
Genital herpes. Just know that HSV1 is oral herpes.
Next slide. So I have seen, hold on.
I've seen all of them.
Candida, huh?
I've seen all of these.
Have you?
Yeah.
Okay, let's talk about them. Candidas, I'm struggling to say the word.
Candidiasis.
Thank you. I always call it candida. Fungal infection of the mouth, usually red or white. Yes, I've seen that. Brush your tongues, everybody. Perileukoplegia is viral infection of the tongue, which are white and raised lesions. And Kaposi sarcoma, cancerous, dark bluish purple lesions involve blood vessels. Everybody's got those 3 written down? Okay.
Can you solve on the test that
They're
So
all associated with HIV, I'm sorry.
It's switched, then describe it and ask what it was and give you a list, or it would, how does perileukoplegia manifest? So they switch up the actual question, but all of these I've seen.
Which of the following infections is associated with HIV? Option, if these are all.
Yep.
Mm-hmm.
Wow, I really know it. Right on.
Hey, 25th time to try.
I ain't never seen this one.
If you keep taking it, you'll remember. You'll see them.
Yeah.
I've taken it quite a few times. All right. Oral cancers. So definitely know the difference between benign tumors and malignant tumors. Oh, oral cancers most often found on the tongue, floor of the mouth, and lower lip. I have seen a test question asking where it's most common. And then I've also seen one where they kind of flipped it and like put a lesion on one of these spots and asked like what it could be. But tongue, floor of the mouth, and lower lip, it usually hides. For the tongue, it's usually like the side of the tongue. For the floor of the mouth, obviously your tongue covers it. Lower lip. Carcinoma is cancer of the epithelium. Adenocarcinoma found in the salivary glands or palate. Sarcomas affect supportive and connective tissues of the jaw. Snuff, dipper's patch, smokeless chewing tobacco. Smooth or scaly white patch called leukoplakia, or snuffer's dipper keratosis. Irritation occurs because 90% of the nicotine of smokeless tobacco directly absorbs into the oral mucosa and bloodstream.
I'm laughing at the last sentence on there.
Oh, smoking cessation classes are available through Navy Hospital. Absolutely they are.
I haven't seen one in months since I've been here. Do they even exist?
Yeah.
It goes over some congenital disorders. I don't remember seeing any of these.
Some of them are on there.
I was going to say supernumerary teeth.
Cleft palate.
That's extra teeth. Some people have more than 30, or born with more than
I don't
32
think I've
teeth.
seen endodontia at all. Anodontia.
I haven't seen that either. Ankyloglossia is tongue-tied.
Oh, yeah.
So that's whenever your tongue is attached to your lingual foramen.
Yeah, but
Can they do a surgery on the
truncated
tentacle?
foramen?
They do laser, I think, more often now, but, well, civilian side, I don't know about Navy.
Which other one did y'all see? It was what?
Supernumerary.
Yeah.
Have you seen cleft lip or cleft palate?
I
I've seen it once.
once, like,
Yeah.
probably about 2014 or so.
Okay. And ankyloglossia, I would just know what that is. Have y'all seen ankyloglossia tongue-tied?
No, I
Okay.
didn't even know there was a name for it.
Uh-huh.
I just know this tongue time.
Yeah,
Pretty sure I saw it last night.
You did see that one? Okay.
What? Ankylo?
Ankyloglossia. Tongue-tied?
Subglossia.
Subglossia
right?
is the tongue.
Your tongue tied to your ankle.
No.
Hey, that's one way to
You
think
the
about
rat
it.
pack, you get the anatomy wrong. Alright. Lovely tune.
You're getting tied up, right?
Yeah, but.
All right, I'm gonna hit this next one. I'm running out of time.
That's okay. I'll give that.
I don't think I've seen any of these. Impaction, attrition, abrasion. Have y'all seen any of these?
Yes, easiest way to remember
See
it.
which one? Impaction.
So
Impaction is impacted. So whenever one tooth is hitting another, when teeth are blocked by a physical barrier. So I don't know. We know what impact means, right? One tooth is impacting on another.
an easy.
Attrition. That's tooth to tooth, wearing away of the teeth. That's grinding. Attrition is grinding.
Second bullet there, caused by chewing, grinding, or other oral habits,
Mhm.
usually when you're asleep. So people who chew in their sleep will be wearing down their nasal strips to attrition.
Yeah.
So an easy way to remember it too, if you look at the word attrition, there's two T's at the beginning, which means it's tooth on tooth. So, because there's different types of ways of erosion or teeth doing it. So erosion is a chemical process, abrasion is an external agent, and attrition is tooth on tooth.
So he beat me to it. Abrasion. So the BR, I think brush. Usually people brush really hard. That's whenever I see abrasion in the clinic. Yeah, loss of tooth structure, secondary. So abrasion, BR, brushing hard, abrasion, attrition. I'm gonna hit this next one so we can go over erosion. Erosion is loss of tooth substances from a chemical process that doesn't involve bacteria. So this acid causes erosion. So you see it in people who have struggled with bulimia, people who eat or suck on lemons, Marines and their monsters, things like that is when you'll see erosion.
That's meth too, you'll see erosion, right?
Say again?
Meth.
Stuck on the
you'll see
meth
erosion.
over here.
Yeah, you can see erosion.
I mean, because it's an acid, right?
Yeah, for sure.
Soda also does it too to your teeth.
All right. I am running out of time, so I'm going to run through chapter 15.